My favorite, Robin Tassinari, is back here. You know, Robin is professor at Albany Med and a great guy and a psychiatrist. And I wanted him to come on today and talk about hypochondria. That's those of us who go to the doctor and think we may have something real bad. You'll all remember Woody Allen thinking he had a brain tumor, which he always thought he had, and then coming out in one of his films and clicking his heels together and basically saying, well, I beat it again. I know a lot of people, for example, who think the way to get rid of disease and not have disease is claim you're dying every day of your life. Anyway, Robin, welcome.
Thank you very much for inviting me.
Are you serious today? Are you in a serious mood or not a serious
Never.
mood? No,
never.
Not really. Well, Doc, tell me. What is hypochondria?
Well, there is a disorder called hypochondriasis, which is a specific disorder. Fortunately, it's not terribly common.
You get it between your toes?
You get it anywhere. Well, you know, you've had it for a long time.
Yeah, right.
Hypochondriasis is fairly rare. It's a condition in which a patient has many somatic complaints and cannot
Wait a second. This is a show for all the people. Somatic. What is somatic?
Medical complaints. They have a headache. They have a backache. They think they have a tumor. They think that you know, their leg is getting numb, and they go for a workup and they cannot be reassured by the doctor.
So the doctor says, "Look, you know, you don't have it," and you look at them and you say, "But I could have it, couldn't I?"
Right. It's an obsession with illness, and it's difficult to treat because these people tend to what we call doctor shop. If they're not satisfied with the doctor's explanation, they'll go to someone else.
Right.
Unfortunately, they may indeed get into some difficult things. They may find a doctor who's willing to do some invasive tests. And they could end up,
sooner or later,
right.
They say, my back hurts. The doctor says, well, we'll cut you open and see what we find.
So it's something that should be diagnosed.
Right.
Now, again, I said it's fairly rare. On the other hand, I'm glad you asked me to do this because there is a whole array of disorders which present with hypochondriacal symptoms. Now, that's much more common, and it's estimated that up to 50% of the patients seen by a generalist, like a family practitioner or patients who go to internal medicine practitioners, have medical complaints but do not have a medical condition, basically an underlying psychiatric condition.
They have basically an underlying psychiatric condition.
Which presents with medical symptoms.
So if a guy loses his job, to put a face on it, he might be likely to begin to feel a backache and to go in and to say, because everything tightens up or something like that, he goes into the doctor and he says, doctor, I think I have a tumor in my back.
Absolutely. And indeed, if somebody loses his job, he could develop a major depression. And, you know, you and I, or anyone, when you mention the term depression, the first thing you think of is, of course, what? Sadness.
Yeah.
Patients with depression do not have to be sad, but they may have diagnostic criteria for major depression, a majority of which can be somatic complaints. A good example is the elderly patient who gets depressed.
Yeah.
They don't always present with sadness. They may look really good. They may smile, but, oh, my back hurts. I can't eat anymore. I'm losing weight. And the doctor thinks right away, my gosh, it could be something medical. So medical complaints go along with anxiety disorders, depression, several other disorders, including hypochondriasis. And it's important to recognize that when someone complains about medical complaints, sure, they could be hypochondriacs, but we should always consider that there may be an underlying psychological condition, stress, anxiety.
Well, not only stress and anxiety, but the doctors have a little bit of a problem too, don't they? Which is that in an age of testing and of legal practice and people suing doctors all the time, somebody comes in and says, doctor, I think I have a brain tumor in my right ear. Now, the doctor can know intuitively this guy hasn't got bupkis. We're going to send him away. But if he doesn't do all the tests, and lo and behold, it turns out he does have a tumor in the right ear, there could be a real significant fallout here, right?
That's very sad, but it's true. There's a tremendous amount of defensive medicine practice that's true. And years ago, the old clinician would reassure and say, look, I know that, you know, that just, it would be so remote that it's not worth your going through the test, and they may do it. The other thing is we live also in a culture where we're very health conscious. You watch TV and every other ad is the warning signals for cancer. Learn about lupus.
Hey,
learn about this. So
watch this program every week, and you think you have every disease, right?
That's right. So we encourage the public to understand disease and to look for little symptoms that could, you know, possibly be the precursor of an illness. And then we get upset when they become hypochondriacal. So you have to kind of balance the two. Patients should be reassured when they go to the doctor and say, gee, I have this swelling or something, and the doctor looks it over and says, no, it's the bruise or it's this or it's that. The patient should be reassured and say, okay, I feel confident.
But every doctor who comes on this show says, okay, warts that look like this, that go a little bigger, that change color, you should immediately go because otherwise it will eat your body. So we're creating, as you say, this awareness, and everybody gets a prize from this association or that association, you know, for making people aware of these potential diseases. That's a big problem.
It's very true. It's in a health conscious society where there's a lot of education. You can't read any journal or Reader's Digest or read any of these magazines without finding a disease in there. You should look for this. If you have these symptoms, call your doctor. So in some ways, we create hypochondriasis, but again, the illness only presents when the patient cannot be reassured and becomes obsessed with the idea that they're ill.
Are more men or more women hypochondriacs?
Well, that's interesting because you get back to the origin of the word hypochondriasis. These kinds of symptoms have gone back to Hippocrates and before, and the Greeks talked about it. They called it hysteria, the term coming from the word for uterus, hyster. And they felt that women had it, mostly, and that it was the uterus wandering around in the abdomen, and that's why they had all these symptoms. Now, they didn't believe in dissection, so they never could prove or disprove it. So even Hippocrates used the term hysteria because he didn't believe in dissection. Now, they realized that there were a group of men that had it. Well, they don't have uteruses. So they coined the phrase hypochondriasis, meaning below the cartilage meaning below the rib cage, basically, in the diaphragm, that something was floating around and it wasn't a uterus, and it was causing these symptoms. So men get them and women get them. It's thought to be more common in women, but I kind of don't believe it.
Are you a hypochondriac?
Are we on the air? Yes. Yes, we all can be hypochondriacs, and occasionally, sure. Working around a hospital, seeing lots of illnesses, physicians are typically hypochondriac. Many physicians are.
Especially when they get into medical school, right?
That's the worst time of all. We had every illness that was in the book.
You presented, right,
Yes.
right. And that's why I'm good at it, too. I love the show, this part of the show, because I've had all of these diseases myself. And that's why I'm an expert in all of them. Is there a hypochondriac in almost every family?
Well, you know, it kind of is culturally based. If you grow up in a household where everybody's very health conscious and always feeling their body, you will create people who are very health conscious and very concerned. Other families ignore it.
So if my mother was a hypochondriac, which I think she was a little bit, then it's more likely I'll be a hypochondriac,
Absolutely.
right?
Absolutely.
And in every house, that's why people fight with each other a little bit, too, sometimes. Is the wife may yell at the husband, you're a hypochondriac, or back and forth, right?
Yes, I've heard that happen before.
Some of that?
Sure.
Doctor, you'll come and see us again, will you not?
Absolutely.
Because you're always fun. I like the way you tell it. Thanks for doing it.
I'll come back again. I appreciate your asking me.
Okay. And
I'll see you Wednesday for your appointment.
Oh, yeah. You're told. We'll see you all next week on See Here.
It's hard for me to say exactly how I feel.